Our collective health has been in such sharp focus throughout this pandemic, but for some people, health is often determined by where they live or their race or ethnicity. In today's KSAT Q&A, we are joined by Dr. Lisa Ochoa, founder of San Antonio Endovascular Clinic, a vascular surgeon here in our community. Dr. Ochoa, thanks for being here with us today to explain this. So you deal with health disparities. You see them all the time. What are the differences and the impacts to people that you see based on where they can get health care?
That's a great question. And so as a vascular surgeon in San Antonio, I take care of all blood vessel problems, but one of the most common things I treat is peripheral arterial disease. And that's the buildup of cholesterol and plaque in the blood vessel that blocks blood flow to the legs. And in our diabetics, who are 2 to 3 times more likely to have this disease process, end up in diabetic amputations. And so when I first moved to San Antonio, I learned quickly that one of those objective healthcare outcomes, like diabetic amputations, varied very differently from the north side of San Antonio and the south. And if you look at even the deep west, 78207, 78237, and south side, we have zip codes in San Antonio that hit 3 times the rate of diabetic amputations compared to zip codes on the north side. And that was one of the first encounters I had with realizing disparities and how we end up with these kind of healthcare outcomes. That's a result of many different things, but one thing we can look objectively is just simple, like you mentioned, access to care. The number of clinics, of hospitals, of doctors that you can actually visit on the south or deep west side versus the north side. And that itself, there's a profound disparity. And my practice focuses in those zip codes, the highest diabetic amputation rates, while hopefully we have a bigger impact in those populations.
Insurance also an issue in all of this, health insurance, whether people have it or not. And what can we do to make that better? I mean, how can we improve the situation? And I'm guessing it's a situation that's just been accentuated with the pandemic and COVID and all of that going on.
You're exactly right. Access to health insurance is also access to care. If you don't have health insurance, you can't access the clinic down the road or the hospital. With the pandemic, we had more people lose jobs, and because a lot of insurance, health insurance is job-based, they've lost their insurance. One of the things I think we all know that in Texas, we have not expanded Medicaid, and that alone would increase the amount of people who can be insured. But even now, and this is another part of the disparities, there are many, many people in these areas that qualify for stuff like Medicaid or county health insurance or can go to federally qualified healthcare centers. But because they also don't have the access to that health information and the guidance to go through that process, which can be complicated, even those that could have some kind of insurance or funding don't have access to it because of that barrier alone.
You've talked about how this is not a new problem for South Texas or San Antonio. There's a history of these disparities in our community.
There is a history of these disparities, and if you look at a red line map of 1930 San Antonio, where of the red line areas after the Great Depression when certain areas were valued, those red line areas are minority populations, are Hispanic populations, African American populations. And it's interesting, if you're going to look at a red line 1930s map side by side with today's diabetic amputation rate map, or access to internet, or access to healthcare, or asthma exacerbations, those maps look the same. So that tells me that the intentional inequities or segregation that happened decades ago still have an impact on us today.
Do there need to be incentives to have more physicians and clinics and things like that in, like you said, the deep west side and then the south side of the city? I mean, is that part of the solution on all of this?
You're exactly right. How do we encourage physicians to come? And how do we keep the physicians that we are training in San Antonio in these areas? I do believe that if we can incentivize them with maybe easier tax rate or incentives to get their loans paid off. I know we have those incentives in rural areas, but the outcomes in these urban areas in the south side and the west side had similar outcomes to some rural areas. So if we could create some of those financial incentives for independent physicians to set up their own practice, that would be great. And the fact that we have UHS that has bought some land on the south side near Texas A&M and building a county hospital on the south side, I think that's another step forward. And if we can prioritize that to hopefully kind of meet these inequities that have been going on for decades and decades, if we can make that a priority, then I think we can begin to make some strides in access to care.
Yeah, we are seeing some of our hospital systems move into underserved areas or in rural communities that don't have that same access that we do here in town. What's your advice to a patient or somebody who may live in one of these communities you're talking about, the west side, the south side? They're hearing this and wondering how the place that they call home is going to impact their health. What would you tell them?
So I would tell them, one is understand exactly what is going on from a healthcare aspect in your community. And I think they live it, they know it, they just haven't acknowledged that. And then realize that they have control over what's in their community on how much they invest in the local community, as well as vote. You know, their vote is their voice. And so whether it's on a local election, a countywide election, a statewide election, I encourage our West Siders and our South Siders, who I think typically don't feel they have a voice, this is your voice, to ask for all those resources that will serve your community, that will serve your children, and hopefully lead to more prosperity for all these families.
Dr. Cho, before I let you go, you and I talked about a year ago about some of what we're talking about tonight, but also you talked about the fact that there are a lot of people that need to come in and get their circulation checked, that have diabetes, that have some of these high risk things going on, and they just weren't showing up because of fear of COVID and fear of the pandemic. Is that still playing out today in San Antonio?
See, that's a great question. The answer is yes. What I was finding was that patients were not coming in for the routine vascular exams. We know that patients with diabetes are at high risk for peripheral arterial disease. And when we don't monitor that and progresses rapidly, it can lead to ulcers or wounds that don't heal. Across America during this pandemic, we saw an increase of about 50% of diabetic amputations. And so making sure that our diabetics know that they need their circulation checked, even if they have no symptoms, at least yearly, is very important, and not to miss those appointments with your vascular doctor.
Dr. Lisa Ochoa with San Antonio Endovascular Clinic, thanks so much for being here.
Thank you so much. I appreciate your time.
Take care. We'll be right back.